1 year since the president signed a historic health care reform bill into law. What kind of impact is it having on Richmonders and people in other parts of the state? Tonight, Congressman Bobby Scott was the featured speaker at a forum at the General Assembly building. Our Sam Brock asked the congressman his thoughts on the Health Care Reform Act 1 year later. Sam also asked Scott whether he may run for U.S. Senate. Sam's live in the studio.
Bill and Steph, Congressman Scott acknowledged he is weighing a run for U.S. Senate, but probably won't make a decision until July because, frankly, he's got too many other things on his plate, like trying to get Virginians up to speed on the health care bill. If tonight's conversations are any indication, there's quite a bit of work left to do.
As much as we would love to pay everybody's health insurance, we can't. You can't do it. You can't stay open. You can't keep the doors open.
This could be a scene at any restaurant or bar in the country. A couple of local business owners who say they had to stop providing health insurance to their employees and wondering, how will I be affected under the new law? Do I have enough workers to qualify?
You asked us this question, and we all looked at each other and said, well, we assume that you have to have a certain number of employees. I don't know what that is. We don't have any idea. We don't have a clue.
We hope it's 50, though, actually, because we have 21.
The answer is a minimum of 50 full-time employees. Businesses that size who don't provide insurance will pay a fine. But the details of the new health care bill are confusing, even for our elected officials.
What are the basic ground rules for a small business owner?
I don't remember the exact number, but small businesses are exempt from having to provide insurance.
On a night commemorating the 1 year anniversary of the bill signing, Richmond Congressman Bobby Scott looked to provide some clarity on what benefits have already taken effect.
Young people can stay on their parents' policies until 26. Children cannot be denied coverage for pre-existing conditions. We're filling in the donut hole.
And Richmond residents said they generally found the forum helpful.
It's a very complicated issue, and there's so many things that I was able to learn tonight and put in perspective that I didn't really understand as well before.
Now, most of the main elements of the bill don't take effect until the year 2014. Scott says that gives congressional Democrats a little time to figure out one key question: how to get Republicans to agree to actually fund the bill. Sam Brock, CBS 6 News. Back to you.
Thanks, Sam.